Welcome to the question and answer or Q&A follow-up to Tuesday's webinar on Medicare for Christian Scientists. Thank you for joining us today. I'm John Mitchell and I serve as Executive Director and CEO for Ardenwood here in San Francisco. Before we get started, I wanted to mention once again the wisdom of giving thought to a care plan in the event of a need for Christian Science nursing. If you have such a need, we want you to call for support. It's so important for your focus to be on God and healing, not on how to pay for care. Thinking through your options in advance is very helpful. Actually, it's essential. Here's a question for you, or a question you might be asking. Why is Ardenwood promoting Medicare? Well, the answer is we're not. Yet Medicare is simply one option for those who are 65 or over, because we've all paid into Medicare throughout our working lives. Another option is the National Fund for Christian Science Nursing, which offers financial assistance for practitioner fees and Christian Science nursing care. You can find out more on their website at nfcsn.org. Not all Christian Science care facilities are Medicare Part A providers. A list of those that are will be emailed to all registrants, along with a link for the replay of this session. Ardenwood is designated by Medicare as a religious, non-medical healthcare institution in the law, or a rinky for short. And as a rinky, Ardenwood is a Medicare Part A provider. You know, one perception of Medicare is that it demands too many details about your physical well-being. As the payor, Medicare wants to ensure that the care received should be covered. In other words, your care needs would require a hospital setting if you weren't at Ardenwood or another Christian Science facility that includes Medicare Part A. We found that Medicare is much less intrusive than most insurance companies. And as you know, Christian Science nurses do not diagnose, so Medicare receives only general information from us. And finally, the content shared is only informational in purpose and is not intended to be legal advice. A replay of this webinar will be available on our website in the next day or so. As always, please use the Q&A button at the bottom of your screen to submit your questions. Now, let me reintroduce our presenters today. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He also is a certified long-term care insurance strategist. Jim has talked to more than 1,200 Christian Scientists since our first webinar, answering innumerable questions about Medicare, long-term care insurance, and estate planning. He has been a tremendous blessing to our field, and from what he's told me, he's loved working and meeting with all of you. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew & Maher Insurance Services and has been in the business for 17 years now. She's licensed for life insurance, long-term care, and Medicare in several states, and she too has talked to hundreds of Christian Scientists. And Nancy Sedan is Ardenwood's Director of Finance and has extensive experience with Medicare from the perspective of our facility here in San Francisco. So let's get started, Jim, Katie, and Nancy. I've got a number of questions all ready to go.
Okay.
Great to see you all.
Oh, before we started questions, we
yes.
had a couple of slides we wanted to show.
That's right. Excuse me. Go right ahead.
I think it may help clarify a few things, right?
Perfect.
Just a few short ones, just 3 of them.
Okay, so we talked on Tuesday about the different enrollment times in which someone can enroll in Medicare. So it's important to know that the 3 times that you can enroll. Number 1 is the initial enrollment period, and that's when you turn 65. If you're still working, you're on a group plan after you turn 65, and you're on a group plan with 20 or more employees, I know we talked about that, you qualify for a special enrollment period when you retire. We also talked to a lot of Christian Scientists who didn't enroll during their initial enrollment period or that special enrollment period, and they now are subject to the general enrollment period, which may or may not have penalties, but that is, if you missed the other two, that's the time that you would sign up.
And that's what we're going to focus on tonight, because I know we have questions on it, because I've already received calls and emails on it, so.
And then we also wanted to go over a little bit about Part A and Part B and the differences. So Part A is the hospital side, or what would cover you that you could use in a rinky. There are deductibles, costs associated with that. So if you have just Medicare Part A, or even if you have Part A and Part B and you don't have other insurance, on Part A, if you go into a rinky for a Medicare approved stay, there's a deductible that applies for the first 60 days in that facility. And then starting on day 61, the per day cost is $400. After you hit 90 days, you have another 60 days to use for your lifetime at $800 a day is what it would cost for next year for 2023.
Right. One key thing for me, it's easy to remember. Just think of Part A as the accommodation side. Normally, you're going to spend the night somewhere, right? In a religious non-medical healthcare institution like Ardenwood. If you're a non-Christian Scientist, there would be other facilities that would apply to. But normally, Part A accommodation, you're spending the night somewhere. Part B is the opposite. That's kind of your outpatient. If you have an emergency, you need to go to the emergency room, things like that. MRIs, CAT scans, everything that would be covered under Part B, B as in boy. And Katie's right, this year and next year, the deductible is $226, which is not a big deal to most people. The one next to it, the 20%, that's a big deal because it has no cap. So again, the difference between Part A applies to Ardenwood. Part B would be some type of an emergency, outpatient surgery, things like that.
Broken bone, that's common,
Broken bone,
something
right.
like that.
Yeah.
Mhm.
And Jim, if I could just add, just to clarify, the Part A includes the Christian Science nursing care cost, as well as the accommodations, as he said, the room and board. It does not include Christian Science practitioner fees.
Okay.
Thank you, that's important.
And one just quick thing too, I mean, Katie, you've implied this, but I mean, what Part B covers can be extremely costly. You know, these things that you're brought into when you're not even in your own cognizance or under your own, power can be very, very costly.
That's right.
And that you're correct on that. So if you have Medicare Part B, you have that deductible, and then you have that 20% after the deductible. And I know we went over it on Tuesday. We've gone over on previous presentations. There's not a cap on that. The other issue that I talk to is I talk to Christian Scientists who don't have Part B, and they want to know, well, what would that mean if something were to happen? If I'm walking down the street and maybe I fall and someone calls 911 and I'm taken by ambulance to an emergency room. I know, John, you had that experience. And in that case, you would have to pay the full cost because you don't have Part B. You don't have Part B as kind of that buffer to help cover those costs.
So ultimately, you're going to write a check. It just depends on what kind of check you want to write. If you want to write a little check to the insurance company to take care of that enormous check you would write if you didn't have it, or the pretty large check, right, if you have Part B, that 20%, it's easy to sit here and say, well, it's only $5,000 or $6,000 or $8,000. When you have to write a check like that, that's a big deal. It really is. So we just want to show you options, whether you want to take advantage of them or not. It's totally up to you. But we want to make you aware that 20%, again, that's a pretty big hit to most people.
And can I also say, this is a very basic thing. Most people may not need this, but I find it helpful. A premium is something that you pay to have the coverage, and a deductible or a coinsurance, as these amounts here is what you pay if you use the coverage.
That's exactly right.
Yes.
Yep. And to even take it one step further, so whenever you see a dollar amount, dollar sign, that means it's a fixed copay. That means it's set. When you see a percentage, that's why they call it coinsurance. So again, you're right, Nancy, basic terms that we use all the time, and sometimes we forget to go over that. So that's good.
And so your fixed cost is what your premiums are. And the unusual cost is if you actually need to use the insurance.
That's right. Yeah.
Correct.
Right.
Correct.
So where do you sign up? Because everybody wants to know, where's the Medicare office? I go, well, if you looked in San Francisco, it doesn't matter where, you're never going to find one because there are no Medicare offices. To me, that's the most confusing thing about this is you enroll through Social Security, right? That's the one, that's where you go. You can do it. Katie can tell you online, right? It's easy.
You can also call their 800 number, or you can go to a Social Security office to sign up. And then when you're getting mail, you'll also see Center for Medicare and Medicaid Services. So the bill comes from CMS, ID cards, you'll see CMS,
Right.
and they work with Social Security to administer Medicare.
That's right. Administrator, right?
Yep.
Social Security is the money side, the enrollment side, handling the monies, and CMS is kind of the administrator.
But we just wanted to share that kind of
Right.
recap Tuesday before we jump into questions, because we know there's a lot.
Okay.
Great. That was a great start. Here we go. First up, how does one know their supplemental plan is Plan G? These are kind of a recap that we did a couple of these. I thought it'd be worth going over
Okay.
one more time. How does one know if their supplemental plan is Plan G? Does this include Kaiser, for instance? Who carries a Plan G?
Right. The answer is it's real simple. You just open your wallet and look in there, and you've got an ID card from the insurance company on there. And it's going to say, for example, we're fans of United Healthcare AARP. So on there, the card would say Plan G or Plan F or Plan N, like that. Kaiser is not a Medicare supplement plan. That's a Medicare Advantage plan, John, the HMO type plans, which we know aren't really good for Christian Scientists to use at a facility like Ardenwood. So.
Yeah, we really have covered this, but I mean, we hope that people are not in a Medicare Advantage plans from
Right.
if you want care at a place like Ardenwood or a Medicare Part A facility. Question 2, if one had not signed up for Part B for 10 years and is assuming the lowest rate, $164 when you sign up, the monthly fee forever would be $328. Is that correct?
Well, I think that's for a 10-year period then. So what they're talking about?
Yeah, it's
Yeah.
Right.
Okay.
Twice the amount.
The
Right.
penalty.
So what that would mean is, yes, you would pay twice the premium. The caveat on that, and I just want to make this a little more clear, is that premium each year is set by Medicare. So last year was 170.10, next year it's going down. So you would be paying twice whatever the premium is. So the premium does go up over time. So your
Right.
costs would go up over time, but you would continue to pay basically two times the premium
Right.
in that case.
And don't think it's going to go down next year, right? There's a reason why it went down. It has nothing to do with inflation or anything. It had to go down. They overpriced it the year before.
Yeah.
There was a new drug on the market, and they way overpriced it, and they built that price into Medicare. That's just a lot of mumbo jumbo for saying they way overcharged us. Now they're giving us a little bit of a relief, right? Instead of more, that's less is always better than more. So it's $164.90. But that 10% penalty, right? That's based on, so if these increase, so does that 10% penalty,
Correct.
right?
Great. I don't understand the difference between the $1,600 deductible and the Part B deductible. Also, would you please explain the 20%?
That was actually one of the things that we just went over.
Exactly.
So that $1,600 deductible, that applies for Part A for the accommodations side, or what you would use in a rinky. And then Part B, that deductible applies if an emergency happens, or you break a bone and you need to have that set, stuff like that. And then the 20% is after you hit that Part B deductible. So that has that co-insurance or that percentage after you hit the deductible in that case.
So an example on the Part B would be, I need some type of emergency care after January 1, for example. Well, we know, like Nancy pointed out, that deductible, that $226, I have to pay that first. I pay that, and then Medicare is going to pay 80%, so that means I'm going to pay 20%, right, of whatever that Medicare adjusted bill is. So example, $10,000, let's say, Medicare is going to pay 8, I'm going to pay 2. 20% of 10,000 would be $2,000. Pretty simple example.
And can I also add the, you said this in the opening slides, but the 1,600 deductible is all that you would have to pay for the first 60 days of care at a rinky. So a deductible covers those first 60 days.
Okay.
Exactly.
And Nancy, if I went in, for example, let's say I go in January and I received spiritual healing and I'm good, but I need to come back in June. What happens then?
Yes, so Medicare considers each stay a quote episode, and you can actually have several episodes during a year if there was a need. And each time you go into that episode, a new episode, you're going to pay a deductible again. So under Jim's scenario there, if you were in January and then came back in July or June, you'd pay another 1,556 or 1,600. 1,556 is in 2022. You'd pay that $1,600 again for up to the first 60 days. There is one caveat to that, is if you needed to come back for care and less than 60 days had occurred between these episodes, then you wouldn't pay that deductible again, but your day count would pick up from where it left off.
Perfect. Okay.
From the first one.
That makes sense.
Next up, which plans are not rinky friendly and why?
Well, we talked about that, John. That would be the HMO type plans. The ones, if you see Joe Namath on TV, right? You're watching Joe Namath.
Say no to Joe.
Plan. That's
Say
Joe's
no to
not
Joe.
say no to Joe. That's right. Those are the HMO type Medicare Advantage plans. Whether it's, I think I've seen Tom Selleck, Jimmy J.J. Walker, you name it, they're all on there. And those are a network, right? They've got a network, and normally Ardenwood is not part of any network. So that would be more restrictive. Any plan with letters after it, HMO, PPO, anything like that, is going to require a network, and that would not be, Christian Science friendly.
And Nancy, you did a good job talking about the fact that Ardenwood is not considered in network for any Medicare
Right.
Advantage plan. So it takes a lot of kind of coaching and teaching the Medicare Advantage company about the rinky in order to try to get payment.
Exactly. Yes. And it should be said that a Medicare Advantage plan is required to offer all Medicare benefits, which include rinky benefits for a Christian Scientist, but they are not always aware of that law, and we do not fit into their structure, and so we're not in network, and so that means that, as Katie just said, that if you needed to come to Ardenwood for care and you had a Medicare Advantage plan, what would be involved is trying to contact that plan and get, quote, authorization for you to come. And that authorization would be the people from that Advantage plan trying to determine whether or not your care need was eligible. And as a result, there's it becomes quite time consuming for our Christian Science nurses to try to help them understand that they indeed need to be admitting you into our facility under the law. And so that's why we sometimes refer to this as a disadvantage plan.
Yes.
It certainly is an individual decision, and occasionally people do feel that that is the right way to go for them. But if you really want Christian Science care to be your main option, you might prefer Part A and B, which is considered original Medicare, not Medicare Advantage.
Okay.
Exactly. Much easier to deal with. And just think of it this way for our viewers: if you offered a service, whatever your company or whatever, a product or service, and you offered that to a client, and then you didn't get paid for 1-2 years or ever get paid, think of that. That's the kind of the situation we face in terms of these challenges. So we really do appreciate, and you will appreciate, I think, by having original Medicare.
And we're going to talk about too, because now's the time. I don't know if we just go into like a sidebar here for a minute.
Sure.
Now's the time coming up. If somebody wants to disenroll, right, get off one of those Part C plans, now's the time they can do that and go back to original Medicare. So they can absolutely do that. Getting the supplement, that's something we'd talk to them about, make sure they qualify, things like that. But now is the time, John, if people have those plans and they want to disenroll, October 15th through December 7th is now the time to do that.
Yep, really important. Great point, Jim. Next up, do I need Medicare to stay at Ardenwood?
Oh, Medicare is simply one way that your stay could be financed. And if you are over 65 and have been working during your lifetime, then you would have Medicare Part A, assuming you weren't still working with and had an employer plan covering you. So it's just one way that you could pay for the care here. And indeed, you can come at any time that there is a need. This is just one option.
Exactly. Next up, do you feel that the United Healthcare supplement is best? Is Plan G the best supplement plan I can get?
So we work with United Healthcare a lot for a number of reasons. They're very competitively priced, but what we see as far as their claims payability is really, really good. I know we talked on Tuesday. We have numerous different insurance companies that we've just stopped working with, because the last thing I want for my clients to do is to pay the premiums, that money each month to have the plan. And then when you have something happen and the insurance company needs to pay, that they fight you on that. That's just not fun.
Right. Yeah, I agree. United Healthcare, I've been doing this a long time, and they have the largest block of business. Block of business means that's the most people on their Medicare supplement plans. They have almost 4.5 million people. That's a lot, John. And insurance works on the law of large numbers. The larger the group, they can spread the risk and help keep the pricing down. That's a key with United Healthcare. So we found they've been excellent. They're in all states, and we work with a lot of Christian Scientists in different states. So it makes it's a reliable company. It's brand name. And you do have to be a member of AARP. There's no doubt about that, but they have some great benefits to go along with that.
And I can also verify that patients that have come to us covered by Medicare that had a Medicare supplemental plan with United Healthcare AARP, we have had no problems processing the deductible or co-insurance payments that plan would cover.
Okay.
In fact, we found in most cases that if our patient is covered by original Medicare, a supplemental plan, so long as it's one of the standard ones, will pay relatively easily.
That's good.
Are medical exams required for any of these?
No medical exams. That would be kind of the life insurance side. For supplemental plans, for example, they have these guaranteed periods when you first turn 65, right? If you can get the plan, it doesn't matter healthcare or any health conditions, right? You can get it. After you go through that initial enrollment period, or there's not a special enrollment period, you have to answer the health questions. There's no exams required, no pyramid, but you have to be able to answer all the questions. No. I will say this, I've been doing this a long time, on 34 years. Christian Scientists are amazing, because most everyone we talk to, all the health questions are answered no, right? Because they don't receive medical care. So usually they breeze through the application because everything is no. So
in that case, what we do is I go through the application. I just ask them the questions real quick, answer, and then what may be required is sometimes the insurance company says, can you just call the underwriter? The underwriter wants to make sure that I ask the health questions correctly and they answered correctly. And normally it's about a 10 to 15 minute, a very quick call where they just talk to the underwriter and say, no. And then the plan is issued right away.
Not that they don't believe us or anything, but they're just not used to seeing all those questions answered no, quite honestly. That's pretty amazing.
That's great. Next up, can you go over the general enrollment period again? I believe you said it's when I can add Part B. I'm 72 and want to add it. I understand I have to pay a penalty. How long do I have to wait for the supplemental plan to kick in?
So that general enrollment period the next one starts January 1st of 2023, and it goes from January 1st to March 31st. If you apply in January, they've told us you will be effective February 1st, and we can have your supplement also start February 1st as well.
And what was the rest of the question, John? I'm sorry.
I understand I have to pay a penalty because I'm 72. And how long
Right.
do I have to wait for the supplemental plan?
Yeah, so once that Part B is active, so like Katie said, let's say that's February 1, or if it's March 1, whatever it is, that's when the supplement plan can be active, because you have to have both Part A and Part B to be active to get the supplemental plan. Did that make
Great.
sense, Nancy? Did we say that right? You've got to have your A and B, and then once you get your B, then you get the supplemental G.
Yes, just to reiterate,
Alphabet.
Part A is all you need for Ardenwood, but if you
Right.
want to have that Medicare supplemental, you do have to have Part B, and Jim and Katie have given other reasons why Part B might be something a Christian Scientist is interested in.
Exactly. Next up, I am 67 and on my spouse's group health plan. Do I need to enroll for Medicare Parts A and B? He'll
The
be
answer is,
retiring. I'm sorry.
I'm sorry.
Yeah,
Go
I'm
ahead,
sorry. I'm
John,
trying to
I'm
understand the question here. I should have read it ahead of time. He will be retiring in 2023 or next year. He's 68 and does not have Part A and B. Can you go over that special enrollment period, please? We want to make sure we're not to have any penalties. Now, she's 67. Yeah.
Okay,
67 and 68.
right, okay.
So as long as that company, that group health plan, that company has 20 or more employees, 20 is that important number, then you do not have to have Medicare Part A and Part B until you or your spouse are looking to retire and you guys are losing that group plan. Then that's when you qualify for that special enrollment period. You're coming off the group plan, you can get A and B at that time, and a supplement if you wanted to, or just A and B.
Right. So they give you a time frame. And it's kind of funny because people go, well, where's that number 20 come from? So that's Medicare regulation. So if I'm self-employed, if I'm a realtor, an attorney, self-employed, if I work for Joe's Tire Shack with 10 employees, then those rules don't apply. And that's what really messes people up. You must get Medicare or you can face a fine. So that's why we always want to talk about you've got to have with 20 or more. Medicare doesn't care because that group plan with 20 or more, that's considered the primary payer. They're going to pay the claim, right? If you're under 20, you can get in big trouble if you don't have Part A and B and you have a claim, because the insurance company is going to say, listen, we don't have to pay that claim first, right? The insurance company does. And if there's no insurance company, they may look to you and say, John, you wouldn't mind writing a check for 80% of that, would you? Or we're not going to cover the claim. So you have to be really careful. That's why Katie, we always say it's got to be 20 or more, and which most companies in the Bay Area are, but still we see people that, self-employed and they go, gee, I heard my brother-in-law, my neighbor, my coworker told me I don't have to enroll. And yet, right, they're trying to help, but sometimes they're misinformed.
Brother-in-laws give a lot of bad advice.
Yeah.
And it's just so good to know the facts here, because this is not straightforward. Exactly. Next up, I do have one of those HMO type plans and I'm paying a penalty. I was never told about the penalty. I want to get out of that plan and be able to stay at Ardenwood. What is the process to do that? If I drop that plan, how do I get the plan G you were talking about?
So the good news, Jim pointed out, starting in a couple days, the Medicare's annual election period starts their AEP on October 15th. So you can tell your insurance company, I want to disenroll January 1st. I don't want to be covered by you anymore. Take me off your plan, cancel it. And then if you want to look at like a plan G, that's where we can help. We can give you a quote for what it would cost to pay that monthly premium and get you the details. And then you could decide if you wanted to do that. And we would help with the application process to explain what would be needed to get that.
Right. And the good news is too, is when you drop that plan, that penalty is going to go away.
Yes.
Right. On the prescription drug side, that's going to go away. That's going to stop. So that's good news too. So yeah, if you want to say bye to Joe, this is the time to do it, John. Goodbye, Joe, October 15th through December 7th, and get into an original Medicare, which works really well for Christian Scientists.
Say no to Joe. There you go. Okay. I only have Part A and want to add B. You suggested I do that in January. These are kind of repetitive as
Right.
as we can see. Can you please go over how to enroll for that? You mentioned Social Security handles that. Is it best I go down to their office, or should I try to do it online?
So when you're adding Part B, it's a little bit different of a process. If you're signing up for Part A and Part B, that can be done online, no problem. When you are adding Part B and you've already had Medicare Part A, there's a different application that they have you fill out. I recommend, if you can, have that filled out beforehand and take that with you to Social Security. You can always either call or email us. I've emailed that out actually to a couple different Christian Scientists today. But then you have that Part B application ahead of time to go.
Mm-hmm.
Great. What were the costs for Part B again? I'm going to sign up in January. I believe I will have a penalty as I'm 68 in April. Can you tell me how much I should expect to pay?
Yeah, you know what? That's not that that's I'm glad you got a penalty, but the penalty is going to be lessened this year for next year. So before, when you'd sign up during this general enrollment period, right, this January 1st through March 31st, you had to wait until July. So if that individual's birthday was April, right, she would be 3 years without Part B, which means she'd get a 30% penalty. Since her birthday is in April and she's going to enroll before then, she's only subject to a 20% penalty.
If she's 68 already, though.
No, if is she going to be 68, John? I think, or is she 68? She's going to
As
be.
I will be 68 in April.
Yeah,
Okay.
yeah. So right, so that's a big deal. I mean, if you can save 10%, right? That's where these new regulations really help Christian Scientists. Not that you want to pay a penalty, but I'd rather only pay 20% than 30%.
We're also assuming on that, and the background information wasn't there, that they weren't covered by a group plan after they turned 65.
Probably
So
not, right?
if they were covered by a group plan maybe for a year, then they would have less of a
Right,
penalty.
yeah, that's
in that
true
case.
too. Yeah, that's a good point.
Great.
Clear as mud, right? I know this is not easy out there. We're trying, it's right? We go over this every day, day in, day out, and we're just trying to help. So I think bottom line, if it's still confusing, email us privately and we can get back to you, Katie or myself,
Absolutely.
and we'll try and do it that way too.
Yeah.
Perfect. Absolutely. If I drop my current plan, will the penalty stop? I live in Southern California and did get one of those no-cost plans. Oh, that's Joe. I have never used it, but thought it was a good idea to have. The penalty was a shock to me, as I was never told about it.
Right.
That's
yeah, Joe
the
doesn't
challenge
tell
here.
you that, by the way. He tells you all the other things. So yeah, now's the time you can drop that and that penalty will go away.
Yes.
Absolutely. Yeah, if you want to.
Great.
Right. We
Good to know.
talked about, we call, yeah.
Yeah.
Just I know it's repetitive, but we just want to make sure
Yeah.
I'm not laughing at anybody. I'm laughing at myself because I go, did I already say that? Right. The disenrollment, now's the time.
Well, as you said, Katie, I think on Tuesday, these ads are just wall to wall. I mean, they're just everywhere. And so
No,
they
have infomercials. I turned the TV on the other night and there's Humana. They have a 24/7 infomercial now with different insurance companies on different channels telling you, they tell you all the benefits, but like Nancy was saying, they don't tell you you have to be on a network. You can't go out of the network. They just make it sound so good that sometimes people go, well, I should get two, right? I should have two. They're so good. I should get one. My husband should have one. But they don't tell you all the details. And especially if you're a Christian Scientist, they're never going to talk about the fines. They don't understand that. They're not going to tell you about those.
Yeah, goodness. Next up, I do have Medicare A and B. I do not have any supplemental coverage. Is it difficult to get? Do I need to take an exam in order to get a policy? I don't like the idea of paying 20%. That can be very costly.
So I know we touched on that earlier. No, on the Medicare supplement, there are no exams required. It's simply health questions. I know a lot of times, very common when I'm talking to a Christian Scientist and I'm asking the questions and they're like, I don't know what that is. And I'm like,
Right.
then you definitely don't have it. And I'm not a Christian Scientist and I don't understand what a lot of them
Right.
are either. So like the answer is just obviously no in that case. And then, but yeah, no exams required.
Right.
Great. I've got some good questions that have come in during this particular session, so I'm going to read those. I need my spectacles for them because they're small. My birthday is in December at the end of the month. Will I sign up during the open enrollment period or in January? I wasn't clear on that. Thank you.
They don't say, are they suggesting turning 65? Was that it at the end of them?
Let's go with that assumption.
I'm guessing, yeah, December.
Okay.
I mean, let's just say it for that purpose, yeah.
So they're turning 65 in December. That's what we've
Right.
decided. So the month you turn 65, you can actually sign up. You can have your coverage start as early as the first of that month. So even if your birthday is December 31st, you could still have your coverage start December 1st.
Right.
The good news is you're already part of your initial enrollment period because we're less than 3 months before your birthday month. So you can actually reach out to Social Security now and say, I want to sign up for December 1st
Right.
for my coverage to start.
And that's when it would start, as long as you do it before the birthday month. And that is weird, right, John? December 31st, how can I possibly be December 1st, but they push you forward, you don't fall back?
And then on the rare case, occasionally we talk to people that are born on the 1st of the month.
Oh, that's
I
confusing,
know.
right? Okay.
So if my birthday is on December 1st, I can actually have my Medicare A and B start November 1st instead of December 1st.
Hopefully nobody on this call has a
Oh.
first of the month effective date. The most common we see that, John, is that so she could start December. If she did it in December, it would start January. If she waited till January, it would start in February. So that's what they changed instead of having to wait 2 or 3 months. So
Interesting. Next up. My insurance agent signed me up for the Anthem Advantage plan. And last year that included a $500 gift card that could be used at the dentist, for example. I accepted it and used it. Have I done damage to my Medicare coverage in some way or incurred a penalty? Good question.
yeah, not if you're just turning 65, right? There'd be no penalty. But those, I just want to go over some of those Advantage plans, right? They're offering over-the-counter cards, $50 a quarter, $100 a quarter. They're offering pay cell phone, utility bills. You seriously, no, it's amazing. Problem is, that may be good for if you live in Cincinnati, but maybe not good if you live in Pasadena, right? So it really depends on which zip codes. But again, is if your goal as a Christian Scientist is to receive care in a religious non-medical healthcare institution like Ardenwood, then that's not the best plan for you, right? It's just not.
I think, and this is getting a little kind of inside stuff, I think sometimes the confusion for both Christian Scientists and non-Christian Scientists are these Medicare Advantage plans, and why are they coming out with 0 premium and they're giving me a $500 gift card to
Right.
use towards dental and stuff like that. And the honest answer is because if you're a Medicare Advantage member, the insurance company is paid a sum of money each month for you to be a member, whether you go to the doctor, whether you don't. So an insurance company wants as many people on a Medicare Advantage plan as they can,
Right.
because they get paid for each member from the government. So
Yeah.
that's why they throw out these things to entice you, to get you to come to them so that they get more money
Right.
subsidized from the government.
Right. The initial goal from the government was to say, listen, if I pay an HMO company about $1,000 a month, that's about typical, right? Basically, so you're talking about $12,000 a year. That insurance company gets that in per member, and then they're going to provide all that care. So their goal is to get as many members as possible as they can. The government's thinking is, hey, our liability is now $12,000, right? We've paid that out. So if somebody has a catastrophic event happen, we're not on the hook for that. that HMO type company, they're on the hook for all your
That
services,
care.
all your care. But again, ultimately, if the goal is to receive, some type of care, the spiritual care, if you need it at Ardenwood, for example, those plans are not good for you.
Right.
Nancy,
Thank
do
you.
you have anything to add?
Um, I think the couple of things that I think I mentioned before, but if you do come to Ardenwood and you have this Advantage plan, that the idea that you actually have to have your care need assessed and approved by the Advantage plan staff is intrusive, and so it's just not in keeping with the what we would want you to be focusing on when you come. So that's one of the reasons we say that. And I again, as a caveat, I have spoken to a couple of people where those Advantage plan benefits just fit their need right at this moment.
Yeah.
But you're being shown the bigger picture, and
Right.
we're trying to get you the information so you can make the right decision for you.
Correct.
Right.
I'd like to take a minute now to have a commercial on the Advanced Healthcare Directive. It's one thing we haven't really talked about, but how important that is to have your plans in writing in terms of what type of care you would like in the event that you're not able to choose your own type of care. Nancy, do you want to elaborate on that a little bit?
Sure. The Advanced Healthcare Directive is a document that you are able to customize to indicate to your family and friends what your wishes are with regards to your care. If you were in an emergency situation and could not communicate, this document would voice for those around you what your wishes were. For instance, it might say, I would like to have my care at a religious non-medical healthcare institution rather than a hospital. And then this document is a legal document, and it then acts as your proxy. And whoever you have designated in this document also can go to bat for you and make sure that people know what your wishes are. And this has been helpful we've seen it be helpful over and over again when somebody might have been admitted to a hospital without them knowing about it at the time, in order to get them out to come to a Christian Science facility where they really want to be. This document has proved very helpful. So that's one of the benefits. It's also helpful just to think about these things in advance, as John said earlier in the program, just to make sure there's several different questions and things to think through. And it's a good way to open up a conversation with your loved ones as to what your wishes are. And it's also good just to have it in place, taken care of. And if you were ever to come to Ardenwood, we would ask you if you have one, and we'd appreciate it if you did have one. We have it in file, put it in your file. And let's see, and the other good point about this is it's helpful to have it accessible. You want to make sure that whoever is your proxy or the person who's going to act on your behalf, if there's a need, knows where it is and has a copy of it, or both. Some people, in fact, would put it on their refrigerator in case there's 911 is called. That's where a fireman's going to look, we're told. And some people actually keep an electronic version of it and share that with the appropriate people, so that if there is a need, they immediately have it with them. So those are all some good ideas we've been finding helpful for others.
It's so important, as Nancy just said, vitally important. And also you can get a copy of one on our website, ardenwood.org. It is written for the state of California, but we've disseminated it throughout the United States, and might be minor modifications for whatever state that you're in, but please consider and act on having an advanced healthcare directive, whether you're of Medicare age or not. It's really essential.
Nancy, that's a great thought too, as we approach the holiday season. I have no problem my family talking about, healthcare, but some people find it hard to talk to their adult children or it's uncomfortable. But just simply that advanced healthcare directive, that's very, right? That's non-threatening. It's, hey, I love you. I want you to know these are my wishes. And this is where sometimes that's a great way to start a conversation about care, things like that, that are eventually going to happen. Kind of makes everybody get on the same page. So.
Absolutely, Jim. Great point. This is a follow-up to the question we had before. The writer says, I'm the one with the Anthem gift and I'm 78. So it wasn't just when she turned 65. So, but she hasn't done damage to my Medicare coverage in some way or incurred.
No, there's no damage. So once you get Part A and B, that's original Medicare, right? That's what you have to get either a supplement or a Medicare Advantage plan, right? One of the HMO type plans. So essentially, if I'm dropping my HMO plan, I'm going back to original Medicare. So I can absolutely do that. That opens up the entire United States healthcare system, including all the rinkies and Christian Science facilities, right? If they accept Medicare. So it can't hurt you, but you just have to realize that you may have other different types of co-pays, co-insurance that we talked about. But Nancy, you hit the nail on the head when you said, right, they require pre-certification. So these HMO plans, don't think that decision is between your physician or whoever it is. A lot of them require pre-certification, meaning the insurance company ultimately makes the decision on your care. I don't know about you, but I would much rather have original Medicare and have my physician or whoever it is making the decision. They make the decision, it's done with Medicare. If I have that HMO type plan, right, and I have to get pre-certification, I mean, the statistics last year, I just read them, they denied 13% of claims, right, that people should have had service. And I think 18% of those claims would have been covered by original Medicare without any type of pre-certification. So that's why you just have to be careful. And they don't tell you on those commercials. They tell you about all the stuff you're going to get and all the bells and whistles. They're not going to tell you that because that's the truth. And sometimes the truth scares people and they don't want to purchase a product if they know the truth.
That's really good, Jim. And I guess I'd like to just clarify maybe what I said also. The law for somebody being admitted to a rinky does not require a diagnosis, but a Medicare Advantage plan thinks that it does. And so that's where the confusion is. They think that you need to have this kind of and you do have to be pre-certified, you have to be authorized, pre-authorized. But anyway, so that's where our nurses have to educate a Medicare Advantage plan in that our patients do not have to go through a doctor in order to be admitted, but they think they do. And so that's where we get some pushback, and this is all happening when you're first admitted. So it's hope that clarifies a little bit.
Yeah.
And there are hundreds of these different Advantage plans, right? There are many of them. So it's not just like there's a handful or a couple dozen. There are hundreds of them.
And
that's where the confusion is in.
They're highly profitable, John, to the insurance companies. So therefore, you have more and more coming out of the woodwork saying we're going to offer plans this year, whether they're local, regional, or national type plans. So they're all over the place. We live up here in the Sacramento area, and we see new ones come out all the time because incredibly profitable for insurance companies. Think of that when they tell you it's free, right? My mom always said, don't ever believe anyone tells you something's free. It's too good to be true. So you got to read that fine print somewhere.
Exactly. Next up, what do I need to do with my IBM insurance along with Medicare? My husband used to take care of all this stuff.
Right. That's a really good question because
Good question.
A lot of these big companies, IBM, AT&T, PG&E, they offer group retiree Medicare plans, meaning you still have to have Medicare, right? Part A and B, you still have to have that. But then like in this case, IBM would offer their group retiree plan. So I think what I'd really recommend is that you email or call us and we'll try and help you because that's an individual one. But you'd be shocked sometimes that people, we just did an example today, a teacher up here, her plan, a group retiree plan was almost $400 a month. And she's just turning 65. She goes, is that good? I said, well, that's a group retiree plan through a company, much like IBM would be. And I said, well, you can go to the individual market and get a plan for $140. And it was the same. And she's going, well, why would I want to stay on my group retiree plan? Because no one's told you that. So the same holds true for IBM. I have no idea if you're paying zero, a little bit, or a lot, but absolutely look at that. Also, you're protected. So if you ever want to come off those group plans, you are protected and can go to an individual plan guaranteed issue, because the insurance companies look at it as loss of group coverage. All I'm trying to do is put you at your mind at ease by saying you don't have to worry. You still would be covered. People are afraid, Nancy, to drop plans, right? They think if I drop it, I can never get it. But coming off a group plan guarantees your issue going to an individual supplemental plan.
And I want to elaborate on that a little bit. When we talk about guaranteed issue, what that means is we were talking about how you might have to answer those health questions. If you're losing a group plan like that, a retiree group plan, you do not have to answer the health questions. You're automatically approved by the insurance company because you're coming off that group plan. The one other thing is, depending on the type of plan, it might be a Medicare supplement type plan.
Right.
It could also be a Medicare Advantage type plan.
Right.
So on a retiree group plan, sometimes they're supplements and sometimes they're an Advantage plan. And quite frankly, most people don't know. They
don't know.
I worked for this company for years. They're providing me retiree benefits. Here's my ID card.
It must be good the company has it, right? That's the thing. And some of those plans are antiquated, right? They may have been great 20 years ago, but things happen, things change. Cost has definitely gone up from 20 years ago, for example, on those plans. So,
and that would be definitely something. Sorry, Nancy. That would definitely be something to reach out to us to. I've talked to quite a few Christian Scientists where I'm like, do me a favor, can you just take a picture of your ID card and like email it to me or something so that I can see what it is? Because I can usually tell a lot from an ID card where people are going, I don't even know what I have.
Right. Yeah, that's a good point, Katie. Yeah.
And just piggyback on that. It's such a great point you've made. We have seen some patients come with a group health plan that is supposed to act like a Medicare supplemental. And it is difficult to get it to pay because they don't understand what we are.
Right.
So,
okay.
Next up, good discussion. Do you recommend joining AARP for better options? How do their options work with Medicare A and B and other supplemental plans?
So if you go with United Healthcare, they've partnered with AARP. So in that case, you would need to be an AARP member. What we've seen from AARP, one, their discounts are really good.
Yes, they're really
Jim
good.
just signed up for him. His wife loves that,
Right.
he gets good discounts. And two, what we've also seen from AARP is, so anyone that's on Medicare is referred to as a Medicare beneficiary.
Right.
And AARP really goes to bat for Medicare beneficiaries as far as trying to make sure, like, Social Security benefits, they're always trying to make sure that they go up. They're trying to make sure that Medicare beneficiaries are not being taken advantage of from like doctors or hospitals, stuff like that. So they really do a good job of going to bat for people, for sure.
Okay, John, I didn't want to do this, so don't look quick. There's my AARP United Healthcare card. Okay, I actually have it myself. So anyways, I wanted to show you, it's not all bad. So as a matter of fact, okay, my wife said she's not big on me being with, an AARP and Medicare age, but they have incredible benefits. My wife's an avid tennis player, loves tennis and plays. They have this Lifetime centers up here in our area. Lifetime Fitness, gorgeous, beautiful. And sometimes they're, the monthly costs can be $299, $399 a month for a couple. With this company, okay, that we talked about,
with having
AARP and my membership with United Healthcare, they give me a free membership, John. I didn't believe them, okay? So I called them, I said, are you really going to give me a $200 a month free membership? They said, absolutely. That's one of the spiffs of having that supplemental plan. So my wife said, well, maybe that's not so bad when I get Medicare age. But they do. There's a ton, and I know a lot of Christian Science are very health conscious. There's so many different fitness centers and yoga and Pilates and clubs that you can join, and they pay for it.
We are
So
not
I absolutely
affiliated
love
with
that.
Lifetime
Right.
Fitness,
Nothing.
United Healthcare. I think we need
I'm
to-
not. But listen, I've been doing this a long time, and I know it works well for clients. And I feel really good about it. I mean, they're one of the biggest companies out there, and I got them myself. So
Don't leave home without it.
the only. Sorry, I didn't mean that. I just wanted to show you.
No,
that-
that's
Well,
really
I
good
have
to
to.
know. I think that answered the question, and I think that's a
Okay.
great thing to know. We just want to know what works, right? I mean, what is
Right,
the best value and what works? That's what
Right.
that's
That's
the
right.
I
objective
knew he
of
was
these
getting
things.
serious when he pulled the wallet out.
Right. Okay, stand back. Yeah. Next up, supplemental plan G has been mentioned. Will you please explain if this is the best one and why, or if another plan is better? Thank you.
And I think we didn't answer that part of the question earlier. I'm so sorry. I think that was my fault. So there used to, well, there still is something called Plan F, like Frank. But unless you turned 65 prior to January 1st of 2020, you can't get that anymore.
Right.
So Plan G is the best as far as the coverage.
Right.
So with Plan G, they cover everything that Medicare approves except for that Part B deductible, that $226 if you needed medical care. But if you need to stay in a rinky and Medicare approves that stay, that supplement, that Plan G covers all of that.
Right. Right.
Great.
Yeah,
I think I
that
That's
was
really
good.
helpful.
That's really good. Yeah.
Next up, I have been with Part B for several years. Is it advised to add a Part G?
Well, Nancy could probably tell you, right, Nancy, if you see somebody coming in without a supplemental plan, how expensive it can be, right?
Yeah, I think we said on Tuesday, if you do the math, and let's just say your care needs extended the maximum, which certainly everyone expects that not to be the case. But
Mhm.
if you needed to be here 150 days, the total costs for that out of pocket, the co-insurance, the deductibles would be about $61,000. So it's really just a financial decision as to whether or not Medicare supplemental policies works for your family. Of course, you have to pay premiums on that supplemental and policy each month. But what the benefit is you're getting this assurance, as any insurance is, that they will pay these costs should you ever need them. And it's not just one episode that this Medicare
Right.
supplemental
That's
would pay for. It would pay for any episodes if there were more than one. So it again is just a financial protection
Yes.
decision. You know, how am I protecting my other assets, and is this a wise way for us to do that? So.
Right. Total just peace of mind, really knowing that if I have that, hopefully I never have to use it, but if I do, it's much easier to write small checks every month for $100 or whatever it's going to be versus writing those big checks. That's hard to do. So I always tell people, think about it. You know, if you're going to self-fund, well, why do that? Why not self-fund with the insurance company and say, I'm going to give you a little bit every month, right? That's what I choose to do instead of saying, I'm going to save this money in a separate account, because if I had money, whatever I have in my account a year ago, John, it's probably down 20-30%. So I think you insure with the insurance company, and peace of mind for you and your family. Your family doesn't have to worry about it either.
And
Right,
it's one of those
let
things
them
where-
know. Mhm.
Yeah,
Yeah.
Go,
exactly.
sorry.
It's one of those things where we can get you a quote so you can see what the premium would cost. And then you think about it. You
Make your own
trade
choice.
on it, think about it, decide whether that's the best for you. In
Yeah.
some cases it is. And in some cases people say, okay, I understand. I'm good for now.
And that's
And then
okay
you
too.
can apply later or not at
Yeah.
all, but at least you've seen everything and then you can make the decision from there.
John, they have a plan. Sometimes plans are really good. Sometimes they're not as good as they could be.
Right.
Mhm.
Exactly. We're coming up to the top of the hour here. We've got 2 questions left, so the timing
Okay.
is working well. Regarding Medicare Part A, if I worked 30 plus years paying into Social Security and am now self-employed, Am I covered under Medicare Part A when I turn 65?
Yep, yes, you are premium free because you paid in over 40 quarters.
You're eligible
Exactly.
to get
Yep.
it. You won't automatically
Oh,
be
no,
signed
no, I'm
up,
sorry. I didn't mean you.
but
Yeah,
you
but
will
you
be
don't have to pay
eligible for
it. Right.
premium free
Right.
Part A. Yes.
Right.
Yeah, there you go.
Yeah.
Perfect. And one just slipped in here as well. So we have two more left and then we'll wind up. Can I get Plan G coverage through AARP? I think we've already answered that.
Yep.
Yes, the answer is yes.
Call us.
Yeah, and it's a
Call-
standardized plan that you could
Yeah,
get from
that's
a
a good
variety of
point,
different
yes. Yeah, it is.
insurers, but
So you are correct. I
Same
should have been a
benefits.
little more clear on that. So when we went over that whole graph that showed Plan A, Plan C, Plan G,
Mhm.
it's standardized, meaning it's the same in every state except for three. There's three weird
Yeah,
states.
won't worry about it, right? But it is
But in
standardized,
most
yeah.
states, Plan G is the same. In the states where they don't have Plan G, they have something very, very similar. And we're
Right.
familiar with that because we've helped clients in those states as well.
Perfect. Okay, our last question for this session. I have a high deductible plan with Mutual of Omaha and have both A and B Medicare.
Mhm.
Is that a reasonable choice? I've never used Medicare.
Yeah, it can be, right? We run into that. High deductible means, right, Nancy, you're going to pay that portion before the plan actually kicks in. Most of them are probably in the range of $2,200, $2,400 deductible. So you just realize you're going to pay that first. Even though you're paying a premium to that company, you still have that deductible to fill. So it's a personal choice,
Mhm,
right? It
absolutely.
really is.
Mhm.
and would it be true to say, Katie and Jim, that if you're looking at coverage for Part A at a rinky, all of the standardized plans cover all of the co-insurance 100%, and other plans either cover the deductible or not. So
Right,
for
yeah.
Part
Oh,
A,
yeah, they're
all
all
of those
slightly
plans.
different.
Yep.
Yeah.
That's right, Nancy.
Mhm, mhm.
Well, we've come to the end of our time. Thank you, Jim, Katie, and Nancy. This was a very helpful Q&A. Great questions, great answers. And please don't hesitate to call any of these three panelists with Medicare or insurance-related questions at any time. They are all happy to help. One other resource you are welcome to contact is the Christian Science Provider Network, which works directly with Medicare on behalf of Christian Science care facilities, as well as individual Christian Scientists. And you'll see their contact information at the end of this presentation. Now, before we go, I want to mention some upcoming events this fall. Next month in November will be our last estate planning workshops on November 1st and 3rd. And another Q&A on Medicare will be on Thursday, November 10th. Also in November, please join us for an online Bible presentation on the law that reveals health, given by Evan McDonald, a Bible scholar. On Saturday, November 5th, Evan's Bible research will inspire new views of a timeless truth. In December, do you believe December is coming up? We hope you, your family, and friends will join us online for our annual Christmas celebration on Sunday afternoon, December 4th. It's going to be a fun one, so you got to watch. You can find details and register for all our online events on our website, ardenwood.org. Thank you again for joining us today. We look forward to seeing you again in the first week of November. And goodbye for now.
Bye, everybody.
Bye.